Hello, everyone. My name is Alphonso David, and I am the president of the Human Rights Campaign, which is the largest LGBTQ civil rights organization in the nation. A few weeks ago, the Human Rights Campaign announced a $3.2 million two-year partnership with Gilead Sciences to support communities that have been disproportionately impacted by the HIV epidemic in the United States, particularly communities of color. In fact, 1 out of 4 Latino, gay, and bisexual cisgender men, and 1 out of 2 Black, gay, and bisexual cisgender men will be diagnosed with HIV in their lifetime. Today, Shanell McGoy, who is the Director of Corporate Giving at Gilead Sciences, is joining me for a conversation about the grant and what we hope to accomplish with this partnership. Shanell has more than 20 years of experience in the public health arena, in community-based organizations, academic settings, and local, state, and federal government agencies. Prior to joining Gilead, she served as the Director of HIV STD for the Tennessee Department of Health, and she's also a graduate of Spelman College. Shanell, thank you for joining me.
Thank you for having me. It's such a pleasure to be with you.
Likewise. So I have a question for you. Maybe you can tell folks a little bit about why you do the work that you do, what brought you to Gilead specifically, and why it's important to recenter the HIV narrative on Black and Latinx communities.
Thank you for that question. So what brought me to Gilead Sciences was the Gilead Compass Initiative, our 10-year, $100 million commitment to address HIV in the Southern U.S. It was really a culmination of all the experiences that I had and a great opportunity to make an impact in the Southern U.S. Coming from the state of Tennessee, working in HIV and STD, the Compass Initiative really gave me the opportunity to hone in and focus on specific areas to address HIV in the Southern US and create a lasting impact in 16 Southern states. And so it has been such a rewarding experience to be a part of Gilead Sciences and the commitment Gilead has to communities across our country and across our globe.
And we just announced this partnership, as I said, a few weeks ago. What are you hoping to accomplish in this partnership?
Yes, it's important for Gilead to recognize that there are a number of partners that we need to end the epidemic in the U.S. And so those partners include grassroots organizations. It includes national organizations like the Human Rights Campaign and many others. It'll take a multi-sectoral approach to address HIV and end the epidemic. And you also mentioned there was a question you had around disparities. We know that focusing in on communities of color, Black, Latinx communities, geographic areas like the South are important for us to end the epidemic. The Black Americans in the U.S. represent about 13% of the U.S. population and account for about 43% of new diagnoses in our country. Similarly, there are disparities that are undeniable among Latinx communities. Latinx communities represent about 19% of the US population and over a quarter of new diagnoses for HIV. And you also presented a very stigmatizing yet startling statistic around Latinx, gay, bisexual, cisgender men, and Black, gay, and bisexual men. And so we need to focus on communities with the greatest burden, as well as the importance of the multiple identities and influences that impact the HIV epidemic.
I mean, I want to go back to that point that I made when we opened this discussion, because I think it is incredibly important that people appreciate the impact that HIV is still having on Black and brown communities. I think in certain sectors of our culture, people believe that HIV is dead, that you can simply take a pill and protect yourself from getting HIV. But unfortunately, we're seeing in certain communities that we still have a lot of work to do. And that's what I personally hope that we will accomplish as we go through this partnership of increasing awareness, engaging in HIV prevention and testing to make sure that we protect young people who unfortunately are, based on the statistics, disproportionately impacted by HIV.
Yes, and this grant is an extension of the work that Gilead has been doing for many years around health and healthcare equity, and addressing communities that are marginalized and represent these disparities. So we have a number of initiatives like Compass that addresses HIV in the South, like Transcend, which supports transgender communities, a racial equity community impact fund, and many others. But what's different about this commitment is that it expands our commitment to organizations that focus, like yours, on basic human rights, equality, fairness, and inclusion. And so it's a commitment to not only the grassroots partners, but also a large national organization. And we need everyone in this fight. And so, what a time for you. What a time for you, Alphonso, to be president of the Human Rights Campaign. And so what prior experiences have prepared you for this particular moment, a moment that has been shifting in terms of federal priorities, but also that remains consistent in addressing equality?
Well, I would say my entire adult life has prepared me for this, but professionally, the past 20 years, I've been a civil rights lawyer and an advocate for 20 years, litigating cases all over the country. One of the first cases that I took as a civil rights lawyer was defending a man in Wisconsin who was discriminated by his doctor, by his doctor. His doctor refused to perform surgery on him after he found out that he had HIV. And we ended up filing a lawsuit against that doctor because he violated both federal and state law. And after litigating cases all over the country, sort of representing LGBTQ people and people living with HIV, I also spent 12 years in government developing policy. I worked with the state of New York in spearheading the campaign to end HIV as an epidemic. The first state actually to do that, and now other states are looking to do the same thing. HIV as an epidemic has been something that very few people were actually thinking of addressing. Certainly the advocates on the ground have been working on this issue for a very long time, but policymakers and elected officials weren't really focused on how do we end HIV as an epidemic. And I had the privilege of actually working on that campaign, developing state policy, interfacing with federal policy to make sure that we are actually addressing this problem. Now, for the past 4 years, as we all know all too well, we have had inconsistent and in some ways anemic responses to the HIV epidemic by the former administration. And I'm excited that we have a new administration that's really going to make a commitment to HIV prevention and comprehensive healthcare, increasing access to healthcare to make sure that we address the issues of HIV that is plaguing specifically Black and brown communities.
Yes, certainly. Ending the epidemic, HIV epidemic, is certainly a priority for Gilead Sciences as well. We know it's an ambitious challenge, but also we have aspirations that can lead us there through our research and development and even our social responsibility efforts. We know that science alone, as you just mentioned, regarding one of the opportunities that you had to advocate for someone, that science alone is not going to end the epidemic for us, and that there are efforts and programs that address these underlying issues around stigma and discrimination. And so Gilead is committed to that, and we're committed to solutions for pursuing cure strategies and also prevention and treatment efforts. And so with this new opportunity, with this new grant from Gilead, we are excited about it. And I know the community is excited as well. And so I just had a question for you about what the community can expect in terms of actionable and sustainable outcomes from the Human Rights Campaign.
So through our investments, we're going to address HIV prevention and testing. Hundreds of thousands of new HIV diagnoses, I believe, could have been prevented. And the number of people who have HIV could have been decreased. So what we're planning on doing is taking this moment in history and really trying to rewrite the HIV narrative and reinvest in communities of color, specifically focusing on Black gay men, focusing on Latino or Latinx men, in intersectional partnerships with minority-led and minority community-based, I should say, organizations. Through this partnership, we're going to launch a public education campaign to change the narrative by focusing on dismantling stigma and discrimination, while at the same time developing and advancing an inclusive public policy that addresses non-discrimination measures and healthcare disparities among LGBTQ communities. We need to make sure that we appreciate that not one organization or one individual is going to be in the position to really stem the tide of HIV. So what we're doing with this grant is really working collaboratively with our partners on the ground to make sure that we're in a position to actually move the needle forward, to engage in long-standing sort of change, whether it be HIV prevention or awareness. We need to make sure that we're focusing on transformational change, because we know the numbers. I opened with those numbers as it relates to Latinx and Black men. And we all need to be actively invested in making sure that those numbers change. And that's what we're going to be doing with this grant, and focusing on specific metrics that we will be able to measure success over time.
And I know the community is excited, as well as the grassroots organizations you're working with. Can you speak to the importance of having many minority-led organizations, grassroots organizations involved in this partnership and really connecting with communities of color?
I believe that that's the key, to be frank with you. I think that when we talk about all of the factors that influence the rates of HIV, many of those factors have to do with trust and awareness. And the community-based organizations that have been doing this work for such a long time, in many cases, have those relationships. They're in a position to actually connect with people in communities so that we can get the word out, we can provide information. And it's no secret, and we've seen this now with COVID-19, with Black and brown communities, there is an understandable fear of, the medical or the medical institutions that have historically been, responsible for providing healthcare in this country. And there's a good reason, because unfortunately, in some cases, Black and brown communities served as guinea pigs. And so people are fearful in some cases of engaging with doctors and hospitals and medical facilities because sometimes you can't know what you're getting. So the community-based organizations and the partnerships that we are going to be building on and leveraging here to make sure we connect with people is key to not only addressing the stigma that I think that we still see in the realm of HIV care and prevention, but also making sure that we're increasing the awareness in the communities all over the country, specifically, of course, focusing on the South, but we need to make sure that we're looking at this issue throughout the country as well.
So important for the work that representation matters, right? So representation from grassroots organizations that can really connect with people who are most impacted. And you spoke about geographic disparities as well. New diagnoses in the Southern US are about 52%, or over half of the new diagnoses in the US. And so how will HRC leverage this Gilead partnership, as well as the community partnerships, for greater support for your larger commitments? We've heard a lot in the news about the Equality Act, for sure. And so, how will this opportunity, this funding opportunity from Gilead, be an opportunity to leverage the work around your other commitments to address equality?
Sure. This grant will allow the Human Rights Campaign to work directly with advocates, as I mentioned before, but also historically Black colleges and universities, as well as youth-serving professionals, and especially those in the Black and Latinx communities in the South and around the country. So we're going to be working with a variety of stakeholders to make sure we advance this important work, increase awareness of life-saving treatments and prevention options in order to reduce health disparities, as well as combating discrimination and stigma. Where in addition to doing this work on the ground, we're also advancing federal policy. As you mentioned, the Equality Act is one of our priorities. The Equality Act is federal legislation that is currently pending in both houses, and it would provide comprehensive legal protections to LGBTQ people. That currently does not exist. So in 29 states in this country, LGBTQ people do not have comprehensive legal protections, which is why we need those protections enshrined in statute. And we have both the House and the Senate are advancing the bill, the Equality Act, and we will be engaging with the houses over the next few weeks and months to make sure that it passes. The stigma associated with HIV in many cases is still attached to the LGBTQ community. And unfortunately, being LGBTQ in certain states means that you will face discrimination and you have no recourse under state law or, in this case, under federal law. So we will be intertwining all of our priorities to make sure that they're complementing each other, that we're able to leverage our relationships that we're building to pass federal legislation. At the same time, we are engaging with community-based organizations to engage in prevention options and life-saving treatments.
Thank you for that. I'm thinking about Memphis, Tennessee, and an LGBTQ college student at Lemoyne-on, an HBCU there. Why is the Equality Act important to me if I'm that student at Lemoyne-on? What's in it for me, and how will it protect me and advance my social mobility?
So if you're a student at a school in Mississippi and you're trying to think about why the Equality Act is important, the Equality Act will ensure that you're treated with fairness in your identity. It's probably the best way I can frame it. So I'll give you an example. I'm a Black man, I'm a gay man. But if I go into a retail store to purchase a new pair of jeans, I could face discrimination, either as a Black man or as a gay man, and I would have no recourse under federal law. Why? Because there is no federal law that prohibits discrimination on the basis of race, or on the basis of sexual orientation, or on the basis of gender identity. So if you are going to school in Mississippi and thinking about why is the Equality Act important, just think about it through that context. Or I'll give you another example. Assume that you're traveling and you get into one of these transportation hubs, say an Uber or a Lyft, and you're traveling to see your parents or see a friend, and you're on the phone, and it becomes quite clear to the person who's driving the car that you may be LGBTQ, and they try to throw you out of their car. You would have no protection under federal law. You would have to live in a state that has protections. And as I said before, in 29 states in this country, there are no comprehensive protections for LGBTQ people. So the Equality Act is core and central to our quest for full equality. And we need to make sure that LGBTQ people are treated equally under law. Because if we're not, then we're treated as second-class citizens. And we've seen it, we saw it for the past 4 years, that LGBTQ people were demoralized and demonized in some cases. And we need to make sure that we have legal protections to protect LGBTQ people. Whether you're old or young, we need to make sure that you have legal protections under law.
It's just, it makes me speechless to think that these protections don't exist in 2021, for sure.
Well, I mean, this sort of goes to the, one of the reasons why I'm excited about this grant, because we often talk about perception versus reality. And the reality is most people assume that LGBTQ people are protected. Most people assume that there is not an HIV epidemic in this country, right? And we need to make sure that we break that perception and show people the reality. And the reality here is we have a lot of work to do. And when we decided to enter into this partnership with Gilead, we saw this as an opportunity to increase awareness, save lives, make sure that people have access to prevention, make sure that people have access to healthcare. That's what we're trying to do here, is break that perception matrix and show people what the reality is, working with all of our partners in the South and across the country. So I'm really excited about being able to do this. And Shanell, one point that you referenced earlier, but I think it's worth just fleshing out a little bit more. When it comes to ending the HIV epidemic, what are your goals, long-term goals and priorities at Gilead? What are your long-term goals in sort of ending the HIV epidemic?
Sure. At Gilead, we will continue to focus on the science and innovation, what we're good at. focusing on treatments and preventions, as well as cure strategies for HIV. But we also are focusing on and committed to the social determinants of health, or some of the social factors that influence HIV, that prevent people from seeking care, the medical mistrust that you described, for example, and focusing on mental health, focusing on capacity building for organizations, very similar to how HRC is working with grassroots organizations. Through our Compass initiative, we are giving organizations the tools and skills that they already had, but helping them to build them in a way that's sustainable and impacts the lives of people that they served, as well as through our Transcend initiative, working on wellness and safety and health for our transgender community. We know that there are such pervasive stigma and discrimination and violence within our transgender community. And so working to support organizations that help our transgender community, even through homelessness, for example. Many community-based organizations are addressing the needs of homeless trans people throughout our country. And also addressing racial justice and equity is another piece that we're focused on. So we know it takes all of these things. It takes the science, the innovation, the treatments, the prevention tools, but it also takes a focus on the social factors that influence and lead us to ending the epidemic.
You mentioned something that I think I just want to highlight, because as we talk about awareness, we have to also remind ourselves that members of the trans community are living through an epidemic as well, not only HIV, but violence. So last year, as an example, we had at least, I say at least because that's what we know of, at least 44 transgender and gender nonconforming people were killed in the United States, more than any other year in recorded history. That's important for all of us to know as we think about doing this work and we think about how we address stigma, because I believe stigma equals violence. And I think that as we address issues that have been plaguing minority communities, we need to also appreciate that certain members of our community are at higher risk than others, and members of the trans community are on the top of that list. So we all need to, in addition to doing what we're doing now, trying to end HIV as an epidemic, we also need to be personally invested in addressing the violence that is plaguing members of the trans community.
And this grant that Gilead is supporting with HRC has a specific focus or emphasis in working with transgender communities. Can you tell us a little bit about how what HRC's commitment overall to the safety, the wellness, the protections of trans communities, but also specifically through this grant?
Sure. So when I took over the Human Rights Campaign about 18 months ago, I launched an initiative called the Transgender Justice Initiative. And that was really, the genesis of this initiative was based on conversations and meetings that I had with grassroots advocates all over the country, talking about many of the challenges that they were facing and what they wanted the Human Rights Campaign to do. And so we launched this initiative that focuses on 4 components. One is employment opportunities. Many people may not know this, but members of the trans community, in some cases, have the unemployment rate is 3 times that of the general population. So we wanted to leverage our relationships with companies and businesses all over the country to see how we can identify additional employment opportunities for members of the trans community and basically create a pipeline. Second, we wanted to address capacity building. We have members of the trans community in a variety of different roles, government, not-for-profit, private sector, but we wanted to create a capacity building program where we could provide resources and support to fellows over the course of the year. So we identified 10 fellows over the course of the year, and we provide them with support and resources so they can become even more effective advocates to the extent they're working in the healthcare field or generally in the not-for-profit field, become more effective advocates moving forward. Third, we wanted to address public education. There is a perception that when you address trans issues, generally in the media or in the press, is usually from a negative perspective, meaning something bad has happened. And we wanted to talk about some positive stories about members of the trans community that are contributing to their communities, that are in love, that are having families. And so we entered into this partnership with Warner Media, where we have launched PSAs all over the country, with members of the trans community talking about themselves, talking about what makes them, what they dream about, what their relationships are like, how they contribute to their society, because we wanted to make sure that we showed the flip side of the narrative that we often see in the press. And then finally, we wanted to address violence, as I said before, in communities all over the country. So we launched a pledge asking all local officials to sign this pledge to basically say that they were going to be actively involved in developing meaningful solutions in their communities in addressing violence against the trans community. So that is the initiative that we launched. It is working incredibly well. We have hired Tori Cooper, who's the Director of Community Engagement for the entire program nationally. And what we plan on doing is, in addition to those 4 pillars that I mentioned, is highlighting how HIV is actually affecting the trans community. And in addition to addressing violence and capacity building and public education and employment, also addressing the pervasive stigma and discrimination that we're seeing against trans people, and making sure that we also have access to prevention. We have prevention strategies and tools, and that we also provide meaningful access to healthcare. To the extent people don't have the information, they should get the information to make sure that they can adequately protect themselves.
Just a beautiful way of providing complete, holistic approaches to addressing the transgender community. It's just amazing to hear so much of what HRC is doing to support this community. We know how important employment is, of course, and then healthcare and education, and telling and sharing a story or a narrative that negates what so many people may believe or have seen in media, and certainly addressing violence with solutions from the transgender community. So it's just amazing to hear. It's phenomenal work that you're doing. And Gilead is a proud partner, and we really support the efforts that you are doing to address and support this community.
Thank you. Thank you. I think that throughout this work, we're ultimately dealing with stigma. Mm-hmm. And we are still living with the stigma created, say, in the 1980s with the HIV/AIDS epidemic, when we lost thousands and thousands and thousands of people to AIDS. And that narrative was written in the 1980s, that HIV/AIDS was a death sentence. And there were many unfounded claims about how you can contract HIV. Now, most of those narratives have been debunked, but we're still living with the remnants of disinformation and lack of awareness. And so what I'm looking to do with this grant, and working with you and your partners at Gilead and all of our community partners, is break down the silos that have existed for so long and actually get more information out to people about HIV prevention, comprehensive sexual education, increasing access to healthcare, because that is, to your point earlier, how we will really be able to break down this paradigm that has existed and been perpetuated for such a long time.
And we talked about one of the settings where you will provide this education around HIV, and that's at historically Black colleges and universities. I believe you're partnering with more than 30 HBCUs across the country, largely HBCUs situated in the Southern U.S. And so the geographic disparities that exist in the Southern U.S. around HIV, and then also working with these historically Black colleges and universities that have LGBTQ youth on their campuses, and we know who are at greater risk for HIV. And so can you speak to the importance of working with HBCUs?
Sure. Well, we have a HBCU program that's been running now for more than 10 years, where we are identifying the leaders of tomorrow, making sure that LGBTQ people, who are also people of color, going to HBCUs understand that there are resources that they could take advantage of, that there is support out there for them, that maybe they're facing bullying, maybe they're facing harassment, maybe they're facing discrimination, but they're tools that we can use to make sure we provide them with adequate support. And Leslie Hall is the director of that program, is doing a fantastic job all over the country. So working with HBCUs has been a core part of the Human Rights Campaign's work. Now, what we're doing here is building on that work to make sure that we can connect the dots, working with the HBCUs and the community-based organizations to make sure that the information is effectively transferred to the people who need it the most. Addressing HIV in youth really requires that young people have access to comprehensive sexual health education. And they have to also have the tools that they need to make healthy decisions and reduce the risk of HIV. So, and this is the CDC's most recent data. It showed that 41% of schools in the United States require sex education, and that 34 states and the District of Columbia mandate HIV education, but only 13 states require that HIV education be medically accurate. So, we need to make sure that our young people have access to the information they need. And there are a number of factors that put young people at risk for acquiring HIV. Many young people have low perception of risk. Only, for example, 10% of high school students and 24%, I think, of college students have ever been tested for HIV. 24% of college students have ever been tested for HIV. 46% of sexually active high school students did not use a condom the last time they had sexual intercourse. So almost half of the kids in high school did not use a condom when they had sexual intercourse. And this sort of is a full circle as we talk about stigma, because 84% of young people between the ages of 15 and 24 said that there is stigma in the United States about being HIV positive. And that stigma prevents them from getting tested for HIV. So the work that we're doing with HBCUs is critical as we think about identifying and supporting and harnessing the next wave of leaders. But we also need to make sure that they have all the information they need to adequately protect themselves and engage in sex, but do it safely and understand what the risks are associated with unsafe sex, and also make sure that they can engage in activities so that they prevent themselves from contracting HIV.
Yes, certainly. And for so many youth who have left home for the first time and exploring, their identity and who they are and living their true selves, for being away from home in these college settings, this work is so vital and so important. And also creating an inclusive campus at our HBCUs, one where the discrimination and stigma isn't perpetuated within the institution itself. And so there's so many roles that HRC can play within our HBCUs in supporting our Black, Latinx youth and so many others that attend these schools.
No, you're exactly right. And I think that we have an opportunity here. We have an opportunity to provide information to young people in the way that it has not been provided, certainly not consistently over time. And that's one of the goals that we're hoping to accomplish with this grant. Shanell, as we close out this conversation, I want to just ask whether there is anything that you think is really important to leave people with. What is the takeaway that you want people to have with respect to this partnership? You said a lot during this conversation, I'm sure. I don't want you to have to regurgitate all of it, but to the extent there is one takeaway that you want people to have from this conversation, from the partnership that the Human Rights Campaign has entered into with Gilead, what would that be?
Yes, that Gilead is committed to supporting our partners like HRC. Gilead is also committed to innovation. Innovation, as I mentioned before, in terms of our treatments, our prevention tools, our medicines, as well as finding a cure, pursuing cure strategies. But we're also committed to addressing stigma, discrimination, and creating an inclusive community and environment for everyone. So not only through our medicines, but knowing that we are more than medicine, and supporting issues around equality and racial justice and inclusiveness and fairness. So much of the work that HRC is doing. And so through this partnership and many other partnerships that Gilead has, we hope to end the epidemic, to end the HIV epidemic in our country and in this world. And so for you, Alphonso, I wanted to leave with a question for you as well. What has your leadership meant to creating a more inclusive agenda for the organization, as well as being a role model and aspiration for Black and Latinx youth that see you in this role and aspire to address equality?
Well, for me, this work, it's all about having us see beyond ourselves. I want us to see ourselves in people who look nothing like us, people who have radically different experiences. We have to see ourselves in other people, and we have to ask others to do the same. Being the first Black person and the first person of color to run the Human Rights Campaign in its history, I believe that I have an obligation to ensure that the path forward is inclusive, that I am not the first and the last one to serve in this capacity, that we are creating a path forward for others to actually serve in this and other capacities. And in order for us to do that, we need to make sure that we break down those silos, that we change the perceptions, that we address the stigma, that young people see themselves with the sort of uninebriated capacity that they have. It's not tempered capacity, it's not limited capacity, that it's unlimited capacity to do anything that they want to do. But in order for them to do that, we need to make sure that they have all of the information that they need to make informed decisions. We need to make sure that we break down the barriers, the systemic barriers of racism and homophobia and transphobia. We need to make sure that we think about how we can get to that place that we call equality, and using platforms like this, working with partners like Gilead, making sure that we can bring the private sector and the non-for-profit sector and government to the table to think about how do we create a landscape moving forward that can make this better than what we inherited. I mean, that's what I see as my goal in this role, and that's what I see as my potential legacy as I think about the work that I have yet to do and the work that we've already accomplished. We need to make sure that we create a path forward that is incredibly inclusive so that young people who are Black and brown don't have to see themselves as the other, but instead see themselves as the one, see themselves as the ones that could actually be creating the path forward for others in generations to come. So I hope that as we do this work, I hope that as we work with our community partners, as we continue to work with Gilead, people will see the promise of this work. They will engage actively, and we will address the HIV epidemic, and we will stem the tide.
Wonderful. Thank you so much. It's been a pleasure speaking with you today.
It's been a pleasure speaking with you as well. And for those who are watching, thank you for joining us. Again, this is Alphonso David. I'm the president of the Human Rights Campaign. And today I was joined by Shanell McGoy, who is the director of corporate giving at Gilead. Thank you again for joining us.